Greetings, it's New Zealand naturopath Eric Bakker. Thanks for joining my video. I'm author of the Candida Crusher and also the formulator of the CanXida, that's with an X, the CanXida range of dietary supplements. I've had quite a few YouTube requests if I could do some more videos on balanitis and prostatitis. Prostatitis is something I've seen now for a long time in a lot of my male patients. It's actually quite a serious problem, and I think a lot of doctors and urologists underplay prostatitis in terms of the connection with a yeast infection. Many of them, in fact, don't even believe that males can have a yeast infection in the prostate, which I find quite hard to believe. So if you've had recurrent antibiotics, okay, like many different rounds of antibiotics, if you've had many visits to the urologist and basically nothing comes up, or the urologist is sick and tired of seeing you or keeps giving you different drugs and you're not getting a resolution, or if you've got some of these signs and symptoms, which I'm about to read out to you in a minute, there's a big chance that you could well have a serious prostatic problem in terms of Candida. So some of these problems here, I'm just going to read them out to you. Pain on or difficulty with urination, blood in the urine, okay, or spots of blood in the urine, joint pain, often moving from joint to joint, unexplained skin rashes, increased food intolerances or allergies, poor sleeping, dry irritated eyes, reduced amount of urine, right? Problems with ejaculation, painful ejaculation, ejaculating a bit of blood, the semen, okay, having no interest or in sex or pleasure in sex anymore. This is a common also prostatitis. Pain down the legs, down the sides of the legs. Could be pain down here or around the ball sack, pardon the expression. Around the testicle area. Could be pain around there, around the perineal area. Often a low-grade sort of a chronic pain or a dull pain can be signs of prostatitis. Always catching colds or flus. Blurry vision. I mean, these are typical signs of Candida, aren't they? Binge eating on sweet foods, liking beer and pizza. So lots of guys I see like beer, for example. Beer's the worst kind of stuff for you to drink when you've got prostatitis, okay? I've got a good friend of mine who loves drinking beer. And he's an electrician friend of mine. He loves beer and he's got a prostate problem, which he's had for many years. And I know that if he doesn't drink beer, if he switches over to vodka or gin, he has less problem with his prostate than if he drinks plenty of beer. But any alcohol consumption is not a good idea with a yeast infection. So, as I mentioned, reduced sexual desire, bronchial cough, asthma, problems with sinus, nosebleeds, palpitations, irritable bowel, cold hands, cold feet, sugar cravings, panic attacks, headaches. I mean, the list goes on and on and on. There are so many different signs and symptoms of chronic prostatitis. So what do you do if you've got chronic prostatitis? Well, if your doctor's giving you no joy at all and the urologist is looking at you, like you're talking some kind of a weird language, it's time for you to see, have a good think about your case history yourself, okay? Do you have a past history of taking antibiotics? Have you been doctor hopping from one doctor or naturopath to another without any results? Do you have all these concomitant symptoms? By concomitant, I mean, do you have all these extra symptoms apart from that pain? Burping, bloating, farting, sugar cravings, sleeping problems, sweating, all these sorts of things could be pointing out towards prostatitis. So what I want you to do is to do my yeast infection quiz. Please go to my quiz, okay? You'll find this on candidacrusher.com. Do the quiz and find out if you're mild, moderate or severe, and then do my program. Okay, you don't have to get my book if you can't afford my book, but you're going to get a lot of benefit from it. Go to yeastinfection.org and have a good look at a lot of the articles I've written just for you guys on, on prostatitis. The big thing is the diet and the lifestyle change. You just have to make these changes. I've seen many patients with chronic prostatitis overcome this problem by making the change. If you make the change will occur. So it's really up to you. But don't despair. Just because you've been told, that there's nothing can be done for you, it doesn't mean to say that you need to take this kind of crappy advice, okay? There's always something that can be done. Thanks for tuning in.